Now let's begin with our last section in which we will talk about the human immunodeficiency virus, HIV. What are the effects of HIV infection on the pregnancy, and what are the effects of pregnancy on disease we will discuss in this section, and also the treatment of HIV or immunodeficiency virus. HIV is the human immunodeficiency virus, and it's the causative agent of AIDS, which is transmitted through the sexual intercourse, and then it is also transmitted through different transfusions, sharing of the needles. So all this should be checked and tested. Sex should be safe sex. Stop AIDS and HIV, and then it can cause, it's important that people should be aware of the mode of transmission of HIV, so they should do the proper measures or follow the proper measures for the transmission of HIV. Testing, they should be tested on and off for HIV, and AIDS awareness should be generated. Implications of pregnancy on disease. Pregnancy does not appear to accelerate the course of HIV infection or increase the chance of developing AIDS. So as far as pregnancy is concerned, it has no direct effect on the HIV infection or on the chances of developing AIDS. Other factors which can be associated with pregnancy can lead to maybe this development of AIDS, but pregnancy itself has no effect. Implications of disease on pregnancy. High risk of vertical transmission is present, occurs transplacentally in antenatal period. So transmission of HIV from the mother to the baby, vertical transmission is high, and it is transmitted through placenta. During vaginal birth and postnatally through breastfeeding. So it can be transferred during the vaginal delivery, and it can be transferred later on by breastfeeding in the milk. Increased risk of miscarriage, fetal growth restriction, prematurity, and stillbirth in women with advanced HIV disease. So pregnancy has no effect on the disease, but disease has so many effects on the baby and fetus because we can transmit the virus through placenta and also through the breast milk. Risk factors for vertical transmission of infection. Increased risk of transmission is mainly if there is advanced maternal HIV disease, high maternal plasma viral load, low CD4 count, prolonged rupture of membrane, chorioamnionitis, preterm delivery, coexisting viral infection, breastfeeding doubles transmission rate. So all these are the factors associated with increased risk of vertical transmission from the mother to the baby. Reduced risk of transmission if there is low or undetectable viral count at time of delivery, if patient is on antiretroviral therapy, if delivery is done by C-section other than the vaginal delivery, chances are less. If there is exclusive formula feeding, if there is no breastfeeding, no chance of transmission. If there is formula feeding, the chances are reduced. Management of HIV positive pregnant women usually is antenatal care is important, good antenatal care, obstetrical management. Delivery should be performed by C-section if there is chances of vertical transmission. Examination and investigations should be performed. Medical treatment during pregnancy, antiretroviral therapy, and then care during labor and delivery. All these are the management step of delivery of HIV positive pregnant women. Management of HIV in pregnancy. HIV infected pregnant women usually receiving antiretroviral therapy. Usually if they are not receiving antiretroviral therapy, usually they initiate the antiretroviral therapy if no obstetrical contraindication is present as soon as possible. So if they are not on antiretroviral therapy, we should initiate the therapy as soon as possible. If they are already on antiretroviral therapy, assess the patient compliance. If the treatment is helping or affecting the patient, then we should continue the therapy. Intractable vomiting or other conditions that preclude oral intake, then we should begin the therapy as soon as the condition is improved or is better. If the antepartum vaccine is considered, usually if there is hepatitis B vaccine series, hepatitis A vaccine, Tdap, if there is influenza vaccine, there is pneumovax, and then meningococcal vaccine is indicated. Intrapartum management is HIV. One viral load is if it's less than 1,000 copies per ml, of it's more than 1,000 per ml. Then we consider vaginal delivery. Continue antepartum antiretroviral therapy. No intravenous zidovudine is necessary. And then if we add intravenous zidovudine to antepartum antiretroviral therapy for at least 3 hours prior to delivery. Culture antepartum. Continue antepartum antiretroviral therapy and proceed with C-section. So in short term, if patient is already on antiretroviral therapy, we continue with therapy and we should assess the effect of the therapy on the mother. And if the condition is well, we should continue. And if there is complications like vomiting and other abnormalities associated with pregnancy, discontinue the therapy and then start again with antiretroviral therapy. So the management is mainly with antiretroviral regime, and then delivery should be performed with the C-section and avoid the normal vaginal delivery, and then the breastfeeding should be avoided also, because that's the other mean of transfer of infection from the mother to the fetus. So that was all about the HIV infection, and that concludes our lecture topic, infections that occur during pregnancy, in which we talked about different infections that affects perinatal period, and also infections that occur during the delivery. So hopefully you learned about the infections that affects the pregnancy good about after this lecture. Thank you for watching sqadia.com.